Welcome back to another episode of Justice in Scrubs. I'm attorney Richard Hastings, and I'm joined by my co-host,
Dr. Jeff Michaelis.
And today we are going to be talking about a health epidemic. And our guest is Dr. Jeffrey Michaelis. Welcome to the show.
Thank you.
Before we dive in, it's important to remember that the information we provide is for informational purposes only. Every situation is unique, and decisions regarding your health or legal matters should be made after consulting with your own doctor or lawyer. Our aim is to inform and empower, but personal circumstances require personalized advice. We're going to be talking about obesity with our guest, and that is Dr. Jeffrey Michaelis. So why don't we start off by talking about what is obesity and how is it medically defined?
So obesity is just an excess accumulation of fat in one's body. And we usually use the BMI, body mass index. And the body mass index is determined by your height and your weight. The actual formula is kilograms, your weight in kilograms, divided by your height in meters squared. But the easiest thing to do is just put your height and your weight in Google and just ask for the BMI. Now, BMI above 30 is considered obesity. A BMI of above 40 is considered morbid obesity because when you have a BMI above 40, your morbidity rate, or actually risk of dying, is higher just because of your weight.
And one of the easiest ways to determine your BMI is just to buy one of those scales at the store where you stand on it barefooted and it sends electrical impulse through your body, and then it will tell you what your BMI is.
That's absolutely fine.
Okay. So what are the main causes of obesity?
Right. Let's talk about the blame game. It's not all about having too many donuts, okay? Obesity or your weight is controlled by three things: your hormones, your genetics, and your lifestyle. So it's not only about your lifestyle. Some people, unfortunately, no matter what they do, are going to be overweight or obese. They just have the genetic they're predisposed to getting overweight.
Easy for you to say.
Yeah, really. Whoa. Okay. So no matter what they do, they're overweight. Now, yesterday I went to a dairy bar, and I saw this guy who was morbidly obese, and he had 2 banana floats, okay? So he is definitely someone who eats too much. But there are many people that don't eat that much who are still overweight. Now let's talk about the hormones. There's 2 hormones that regulate your weight. One is leptin. Leptin tells your brain that you're full. So if you have an elevated leptin level, then you're going to feel full. And then the other hormone is called Frin. Frin tells you that you're hungry. Now, unfortunately, some people that are obese have resistance to leptin. And when they have resistance to leptin, they're not getting full after they eat. And some people have an elevated number of Frin. Frin is the hormone that makes you hungry. So it is predetermined somewhat how hungry you are and how full you are. Now let's also talk about the metabolic rate. Your metabolic rate is somewhat dictated by your genetics, but it's not hopeless. You can affect your metabolic rate. And
that's how fast your body burns fat?
Right, exactly. Burns any kind of carbohydrates, protein, fat. Mm-hmm. So your metabolic rate you can control somewhat. Now, muscle mass has a higher metabolic rate than fat. So if you increase your muscle mass by doing weightlifting or weight training, that will increase your metabolic rate. Metabolic rate is also controlled by your activity. If you sit in a chair all day long, you're going to have a lower metabolic rate. But if you exercise or even get up and do brisk walking, your metabolic rate will increase. Now, one thing some people do is they skip meals or they fast. If you fast, you're going to get nowhere because you're lowering your metabolic rate, and that will cause you to not lose weight. So fasting or skipping meals is not a good idea.
So let me ask you, these intermittent fasting, that is a bad idea?
Well, you're not. What you're doing when you're doing intermittent fasting is you're not skipping a meal. So what you do is you might have dinner around 6 o'clock, and then you don't eat till the next morning, which is fine. But you don't want to skip meals. So some people like to not eat after dinner, and that's a good idea. But you do not want to skip meals. Also, you want to stay hydrated. Because remember, people tell you that you should drink 4 or 5 glasses a day. The reason why is because when you're dehydrated, you have a lower metabolic rate. And also, you should sleep well. If you sleep well, it can affect your metabolic rate also.
So let's talk about leptin levels, Frin levels, and metabolic rates. Excuse me. So what are some things we can do to increase our leptin levels so we feel like we're full?
Well, we're going to talk about it later. The medications help you with that. There's nothing you really can do to do that. You could change that.
It's not like you drink a lot of water or you eat a lot of lettuce or you...
No. I mean, you can affect your metabolic rate, but you really can't affect your hormones. And that's what we'll talk about later about the medicines. That's how they work.
Okay. So let's talk about genetics and how that plays a role.
Yeah. Unfortunately, some people just are predisposed to being overweight.
I mean, we call them big boned, for example.
Right. And so not everybody who's overweight eats too many donuts. Some people just are overweight. And actually, most people that are overweight tend to just have the genetic makeup to become overweight. And the best thing to do is if you want to deal with your being overweight, what you should do, you should go to the doctor. And the doctor can look at your medicines to determine some medicines cause you to gain weight, like psychiatric medications can cause you to gain weight. Steroid medications can cause you to gain weight. And then the doctor will do some blood tests, specifically looking at your thyroid. Your thyroid controls your metabolism. So if you're low in thyroid, your metabolism is going to be low, and you'll gain weight. So the first thing we do is we make sure you're not low thyroid or hypothyroid. If you're hypothyroid, we give you medication that will help you lose weight. And it's somewhat common, especially in women, to have hypothyroidism. Now, the next step is we always try to do lifestyle changes. We encourage you to see a nutritionist. We encourage you to see an exercise person or a fitness person. But if that fails, there are good medicines out there now that work fantastic. So you should not dismiss having medication for this.
So we did another episode where we talked about the 5 leading causes of death. And one of those causes of death was accidents. So if you take accidents out of the equation, the other 4 all have the same characteristics in common, and one of those is obesity. And how does obesity affect the different aspects of your health?
That's a great question. So obesity gives you, what it does is it increases your chances of developing heart disease. And because you're obese, it puts extra pressure on your heart, and it causes your blood pressure to go up. It causes your arteries to work harder, increases your risk of developing heart disease. It increases your risk of developing diabetes. Now, if your parents are diabetic, you have a 50% chance of having the predilection to develop diabetes. But just because you have the gene for diabetes doesn't mean you're going to have diabetes. You have to have the excess weight in most cases.
And what does the excess weight do to trigger diabetes?
So what it does is it decreases the sensitivity of insulin. Now, insulin brings the sugar from the blood into your cells. What diabetes is an elevation in your sugar in your blood. And when you have an elevation in sugar in your blood, it causes damage to many organs. So your insulin doesn't work as well when you're overweight. and then it can cause you to have diabetes. Also, it can cause you to have problems with your bones or your joints because the increased weight puts extra pressure on your joints, and you can damage your joints and need knee replacements, especially in women who are overweight. They get knee problems. And then they frequently have to have knee replacements early, like in their 50s, instead of their 80s and 90s with most people. So obesity significantly increases your risk of developing osteoarthritis, especially of your knee. Also, it can cause sleep apnea. So what happens is the fat in your airways when you're sleeping causes an obstruction in your airways. It actually flops in and causes the airways to obstruct. And subconsciously, you wake up through the night trying to clear the airway. And all day long, you're exhausted. You fall asleep when you're driving. You fall asleep when you watch TV. You fall asleep at your desk at the job. So sleep apnea is a very, very important thing to look at if you're falling asleep during the day. And it's totally, absolutely related to your weight.
So I guess the way this becomes obviously apparent to individuals who are that big is they go to their doctor. And then their doctor makes a huge issue about their weight and about how unhealthy they are and about how they perhaps have to make different lifestyle changes.
Right. So, it's sort of like, remember our episode of drug abuse? Mm-hmm. You have to have, or alcoholism. The person or the patient has to have buy-in. We can say to you, you really need to address this. And we can even give you options like medications or lifestyle changes. But we can't just say you better lose weight. We have to have some buy-in from the patients. And nowadays, I think there's more buy-in because people are more aware of it. And also they're flooded with all these advertisements about these new medications. So they're more open to that. But yes, going to the doctor is the first thing you should do and discuss it with them. Because
the thing, and I go to the gym on a regular basis and I watch what I eat and I have lost weight. I've lost probably 20 pounds over the past couple of years. And what amazes me is I'll go to the gym and pick up a 20-pound weight and just walk around with that weight for a while just to realize what it was like to have the extra 20 pounds. Yeah. And it's exhausting.
Right.
And when you have the weight on you, you're carrying it, of course, because you have to, but you don't realize what that is doing to you from a physical standpoint. And if you're morbidly obese, I can't imagine what it's doing to your feet, to your ankles, to your knees, to your hips, to, all of your joints. And then the difficulty in your heart pumping blood through all of that area on you.
That's a great point. And also what happens is when you're obese or overweight, you don't want to get up because it's harder, right? So you end up just sitting. And then it's a bad cycle. It lowers your metabolism rate because you just sit there, and then you're more likely to eat, and then it just gets worse and worse and worse.
It's like you were talking about the guy at the dairy bar. If I drive by a place like Cold Stone, the ice cream place, or I don't eat fast food, but if you go by a McDonald's, for example, you'll see people that are overweight that are making obvious bad food choices. And to me, I guess it must be a situation where it's almost like I surrender. I can't lose the weight, so I might as well be happy.
Right. So that's a great point. It's not hopeless now because we have help for you. And yes, you do need to have some buy-in. You do need to do some lifestyle changes. You need to stop going to McDonald's. You need to stop doing that kind of stuff. But you can have a normal life. With the medications, it will help you. So if you're ready, and I think you should be ready if you're overweight because of all the dangers it can bring on to you, see your doctor and ask for help.
And then, the very extreme end of that is where they have these shows on TV where people are homebound. They weigh more than 600 pounds, and they have trouble getting out of bed. And there's always, which amazes me, there's always some caregiver that is the person responsible for getting massive amounts of food for this individual or preparing massive amounts of food. And it's such an interesting dynamic as kind of a, an enabler who shouldn't be doing it but is doing it and is providing this person with pleasure, but in the same way is actually killing them.
Right. We like to make our loved ones happy, right? But that's not a great way of doing it.
So and I want to get back to the hope, and there is great hope. So the hard things to do are to change your diet and to start exercising, which would include aerobic exercise and weight training, and just to move more. To go to the mall and walk, or to go out on a nice day and walk, or, just engage in some activity that gets your blood pumping through your body.
Right. You don't need to run a marathon.
And I say that's an easy way to do it, but for a lot of people, it's very, very difficult.
Right. First of all, I always tell people you need to do something you like. Because if you don't like it, you're going to do it for a week or 2 weeks, and then you're going to stop. So if you like to bicycle ride, if you like to swim, if you like to walk is great because it can be social. So walking is a great start because it gets you going, it makes you start feeling better, and then maybe you go from a walk to a fast walk and maybe to a light run. But walking is a great start.
And I think it's great just to let people know that, walking is where you start. And the old expression is you have to walk before you run.
Right.
And that's what you do. You just start off slowly. And maybe it's as simple as walking out to the mailbox. And then it's walking, a little bit longer, and then a little bit longer. And then after, and this isn't overnight. This is maybe 2 weeks, 3 weeks, 4 weeks, 2 months, where you're walking, farther and farther. And then one of the nice things for this is you can see the weight loss in a number of ways. Your clothing fits differently. It's looser. Or you stand on the scale and you've lost pounds from your body. So it's like an instant gratification where you can see the progress.
Right. So when I tell people walk and then don't have dessert, if you do those two things, you will see weight loss. Just those two things. And then if it doesn't happen, and you're one of those people that can't lose weight, then you should see your doctor.
Right. And then, other things that are they're easy to do. They require a great deal of discipline, but, whenever we go out to restaurants, first thing they do is they put a basket of bread down. Right. The answer should be no, thank you. Instead of taking, like half a loaf of bread and smearing butter all over it and eating it, that's horrible for you.
Right.
So if you're the person that says, listen, I've had a nutritionist, I've tried to lose weight by watching what I'm eating, I go to Whole Foods, I buy organic, I do whatever I do, and then, I go to the gym, I had a personal trainer, I was in spin class, and I just can't lose the weight, then what can they do? We wanted to take a quick break to remind you about our sponsor, findagreatattorney.com. Dealing with the aftermath of an accident or injury can be overwhelming. And the last thing you want to worry about is finding the right lawyer. Findagreatattorney.com simplifies the process by connecting you with one of the top attorneys in your area who specializes in your specific type of case. Whether you've been injured in a car accident, suffered a slip and fall, or experienced medical malpractice, findagreatattorney.com has a network of experienced lawyers ready to help. And remember, their service is completely free, so you can focus on your recovery without worrying about the cost of legal representation. If you or someone you know needs legal assistance, don't hesitate to visit findagreatattorney.com and let them match you with one of the best lawyers in your area for your needs.
Right. So then these new medicines, they came out a couple of years ago. They're GLP-1 agonists. And what they do is they do two things. They're actually magical medicines. They do two things. They work on your brain and they work on your gut. So what they do is, we were talking about those hormones before, the hormones that make you hungry and the hormones that make you feel full. So it stimulates the hormones that makes you feel full earlier. And also, it also decreases your appetite. So you're decreasing your appetite, you're feeling full sooner, and also what it does in your stomach is it decreases the transit of your food, of the food in your stomach. So the food stays in your stomach longer, and so you feel full longer. So it decreases your appetite and makes you feel full longer after meals. And they're fantastic medicines. First, they were used for diabetes because they significantly lower the sugar after your meal.
And that's Ozempic?
Ozempic, Wegovy, there's a whole bunch of other ones. And there's more newer ones coming out every day. And they do great things. Now, they also, what they do is after you eat, your sugar goes up. Everybody's sugar goes up. It decreases the amount that your sugar goes up, so it decreases the amount of insulin that your body makes. And insulin increases your appetite. So it does amazing things and has minimal side effects.
So how does the medicine trick your mind to think that you're full?
Well, it does it because it keeps the stomach and the food in your stomach longer, so you feel full longer, and also uses those hormones. They work on the hormones. The leptin, remember leptin? Mm-hmm. Leptin makes you feel full longer. So they don't really trick you. They just use the proteins or the hormones in your body to make you feel full longer.
And I had heard years ago that it takes your mind about 15 minutes after your stomach is full to realize that. So lots of times what we'll do is we'll eat and we won't feel full, and we'll eat and we won't feel full, and we'll eat and we won't feel full. And then 15 minutes later, you're feeling like, oh my God, I've eaten way too much.
Right. That's a great point. So what I tell people to do is you need to eat slower. And we're all, we're hungry, we're eating. And I remember when I was a resident and we never know when we can eat, we would rush to eat. And then, we would be hungry again because we were rushing to eat. And then we would not have work, and then we would eat again. And then it was 3 o'clock in the morning, and then we would all eat again because we're up all night. Mm-hmm. So the point is, what I tell people to do is take your fork, eat with the fork, and then put the fork down. And then you pick it up and just remember that. Put the fork down after you take a bite. It just slows you down.
That's interesting.
And it slows you down. And then what happens is it takes a while for your body to feel full. And then when you finish eating, you'll feel full instead of taking everything really quickly. And then you won't be full until later. So it's really important to slow down. And I always tell people to put your fork down, take a drink or something, take a napkin to clean your mouth off, whatever. Slow it down. And that makes a huge difference in eating.
And the other thing that's crazy is the fact that when you go out to a restaurant, most serving sizes for one person is way too much food.
Right.
And the people that feel compelled to finish the food on their plate are doing themselves a great disservice.
Right. There's always a doggy bag. Like last night we went out to dinner. They brought over this big bowl of salad. And there was no way I should have finished it. And we took a doggy bag home, but I did leave the doggy bag at the restaurant.
Well, good. Then you didn't eat it today.
Right.
So, and then the other thing is when we go out, the foods that are most delicious, they say everything's better with butter. The things that they make the foods with are very high in fat, are very caloric. So not only are we eating large portions of food, but we're eating large portions of food that are high in saturated fats.
Yeah, my partner used to always say, if it tastes good, spit it out. But you don't need to do that because there are some very good foods that you can have nowadays with vegetables and things like that.
So let's get back to the medications. Who would be a good candidate for example, the Ozempic?
Right. So we look at the BMI. If your BMI is above 40, you clearly are a candidate for the medication. BMI above 40. If you have a BMI above 35 and you have a medical condition like diabetes, hypertension, high cholesterol, you would be indicated for it at a lower BMI because you have medical problems. And the insurance companies will pay for it. They'll ask what the BMI is and they'll ask what your medical problems are.
And then what about the side effects for these medicines?
Yeah, interesting. The most common side effect is nausea and decreased appetite. And the nausea, there are some patients, there are about 5% of the patients that just can't tolerate it because they actually throw up and get really badly nauseous. One of my medical school friends was very overweight, and he was a diabetic, and he started on Ozempic. He's lost about, remember, this guy's like 6'8". He was huge. He was like a linebacker. So he was like 300, maybe 350. He lost about 60 pounds. His diabetes went away.
Wow.
His hypertension, he was on 3 medications. He's not taking any more blood pressure medicines. He's not taking any cholesterol medicines just because of Ozempic. And he tells me that he's a little nauseous most of, a majority of the time, but what he does is he takes nausea medicines. And he actually also smokes pot, and that helps his nausea too. But but the nausea is usually very mild and is easily controlled with some medication.
And then does that, I guess if you're on that medicine, you don't have the other problem where you go on some diet, you lose all this weight, and then then when you get to your target weight, you start returning to your old lifestyle and you gain back,
That's a great point. The thing is, you can't stop this medication.
You cannot.
Right.
Why?
Once you stop the medicine, you're going to gain the weight back.
Okay.
Because your hormones are going to change back again. You're going to get hungry again. You're not going to be full again. All that stuff is just going to revert back. So you really need to continue the medicine. But if you continue the medicine, you will continue to lose weight, or you'll plateau at a great weight. So remember, this guy, he was on injections of insulin. He's on no diabetes medicines. He was on, I think, 3 or 4 blood pressure medicines, and his blood pressure was not greatly controlled. And he was on a very high dose of cholesterol medication. He's on Ozempic, and that's it.
Wow.
Yeah.
I think I told you before that my PCP, my doctor, told me that 80% of all health challenges are related to being overweight. So if you can stabilize your weight at a good weight, then you have, like your friend, you maybe can stop taking certain medicines.
Absolutely.
One of the things to me that was a little disconcerting was the fact that you look at these online charts. And one of the charts showed that I should weigh 168 pounds.
Right.
And if I weighed 168 pounds, I would be emaciated.
Right.
And to think that that would be a target weight or goal weight of mine is something that I wouldn't even consider.
Right. If you look at the BMI, that's helpful because it has a wider range. So between 25 and 30 is considered overweight, but above 30, most people that are above 30 really are obese. So yes, it's not perfect because if you have a very large muscle mass, muscles weigh more than fat. Mm-hmm. So if you're a bodybuilder, the BMI is not that accurate. And if you have a large, frame or a lot of, more importantly, a lot of muscle, sometimes the BMI is inaccurate.
So let's move on now to surgical options.
Right. So when do we think about surgery? Well, surgery is really thought of when someone is above 40 or they have a lot of medical problems. And if someone is 100 pounds overweight and they have diabetes and hypertension, you can try the medications first, but sometimes people don't tolerate the medicine, or the medicine is not strong enough, or doesn't do the full job. And then you would think about surgery. And surgery we'll go over the different types of surgery, but surgery is definitely an option. I've had a bunch of patients that had diabetes, hypertension, high cholesterol, on insulin, and like a month after they have their surgery, they're off of all their medications.
So let's talk about the different types of surgery.
Right. So the most common surgery is the gastric bypass. What they do is they cut your stomach, and your stomach is now much smaller. And they also change the way the intestines works. So what happens is if your stomach is really small now, so you can't tolerate a lot of food. And actually what you start on is you start on a liquid diet post-op because your stomach is so small that it can't handle solids. So you go on a liquid diet for up to a month, and then you can lose 100 pounds.
Wow.
Afterwards. Now, you got it, the surgery is magical, but then you got to be, it's not just going to work forever if you change your lifestyle, because the stomach will get larger if you start eating again a lot of food.
So how do they make it smaller? Do they band it?
No, they actually cut it out.
Oh, really?
They cut out pieces of it. So the banding is other types of surgery.
So one of the types of surgeries is bariatric.
Well, these bariatric surgeries, or all 4 surgeries are considered bariatric.
Okay, so that's my question. What is bariatric?
Bariatric is, I don't know why they came up with that. Bariatric surgery just means weight loss surgery.
Okay.
That's a fancy term for it. We have fancy terms for everything.
You do.
And sometimes I don't even know what the fancy terms mean.
And lawyers speak in Latin, so
right.
agricolar, res ipsa loquitur.
Whatever that is, yes.
So tell me about the pros and cons of each type of bariatric surgery.
So gastric bypass is the big one. Mm-hmm. It's the big surgery. There's a major weight loss. And we usually only use that for patients that have medical problems. And it's a big deal. It's irreversible, so you can't reverse it. And but it's very, very effective. A problem that it has, since the intestines are going, food's going a different way through the intestines, and the stomach is much smaller, your minerals and your vitamins don't get absorbed sometimes properly. So you have to be monitored for vitamin levels and mineral levels, like calcium, vitamin D, vitamin C, vitamin A, and these all have to be checked. And frequently, B12, vitamin B12, they have to be supplemented, which is not a big deal, but you just have to make sure that you see your doctor post-operatively as often as they want, usually every 3 months, because you got to monitor the vitamin levels and the mineral levels. Because frequently you need supplementation.
So what are the risks and the downsides of weight loss surgery?
Well, the risk is, it's first of all, the gastric bypass is a big surgery. So it's just, you can't have surgery if you have significant heart disease or other things like that. So the risk is really any kind of surgical risk. You can have infection, you can have bleeding. Those are the risks. The other risk is the big thing about the vitamins. The vitamins and the minerals, you might have trouble absorbing them.
So is this something that's covered by insurance under certain circumstances?
Yes. You have to have a BMI above 40, and you have to have medical problems.
Okay. So as I'm understanding it, there are 3 options that an overweight person would have. One is lifestyle change.
Right.
One is medicine. Right. And the other is surgery.
Right.
So how do you have a conversation with a patient about, do you walk them through lifestyle change is what you should do first, and then we'll try medication, and then if that fails, we'll try surgery?
Right. It's a stepwise approach. Mm-hmm. You always start with the least invasive and you always start without medication. So you might send a patient to the nutritionist, you might send them to a fitness person, and early on you'll see if it's going to work. Right? And then if it doesn't work, which it probably doesn't work over 50% of the time, we end up starting medication.
And I would imagine patient buy-in is the most important thing. So
Right.
lifestyle change, that's an easy one to monitor. They're exercising and they're eating right. And you can see them losing weight.
Right.
And obviously if there's no buy-in, those things won't be happening.
Right.
On the medicines, they take the medicines and they continue to take the medicines. And if you don't have buy-in, they're not doing that, and that won't work.
Right.
And then what's the non-buy-in on the surgery? That they just continue to eat as much food as they want, and it'll eventually...
Exactly. It goes. You get reverse of the benefits.
So let's assume you have somebody come into your office who is obese.
Right.
What's the conversation you would have with them, say if they're at 35 or they're at 40 or at 45 body mass index?
Right. So if they're 35 and they don't have any medical problems, we look at it, we really focus in on the medical problems. Are they having orthopedic problems? Are they having sleep apnea? Are they having diabetes, hypertension, things like that? If they don't have any of those, we really focus on lifestyle. And like you said, they have to have buy-in on this. So if they don't really care or they don't want to put the work in, there's not much we can do. But we might just badger them a little bit or slowly. But if they have medical problems, we tell them something has to be done. We can't continue like this.
And I would think almost as important as the patient's buy-in would be the support from family members and friends.
Yes, absolutely.
Because like that 600-pound show they have, if you have somebody at home that's enabling all of this bad behavior, the person could be very strong-willed, but if they're going out to Cold Stone and eating ice cream or getting dessert every time they have dinner or eating things they shouldn't be eating, they're not going to get very far in this journey.
Absolutely. So you get a feel for the patient. You see if they're going to want to do this. And if they don't want to do this, so one of the things that we do, we go through a lot of hoops before we have the surgery.
Sure.
And one of them is we have them see a psychiatrist. Because the psychiatrist is going to say, basically, if they want to do this or not. And the psychiatrist says they don't want to do this, then we won't do it. So it's very important to see a psychiatrist or a social worker or someone like that to see where their head's at.
So somebody comes into your office, they're obviously struggling with their weight, they're very unhappy, perhaps it's creating some, anxiety and depression for them. What would you want them to know and how would you make them feel like there are options available to them?
Right. So you don't impose anything on them. You ask a lot of open-ended questions. Just like when you're talking to a teenager. You don't want to impose anything on them. You want to see where their head's at. So you might say, what do you want to do? Or have you tried anything? Or what do you like to do? Mm-hmm. I always ask them, are there any activities that you like to do? And sometimes they come up with something, and then we work on that. Like some people like to swim. Swimming is a great thing. Or some people like to ski. So whatever it is, that we try to focus in on what they like. And if they say, I hate exercise, then we might say, well, let's do walking. And on your phone, I would take their phone out and I would show them on the phone how they can monitor their steps. And I'd say that 10,000 steps is magical for the weight loss. And 10,000 steps takes a while. It could take 45 minutes to an hour.
Sure.
But if they do that every day, or maybe we'll start with 5,000 and build up to 10,000. Mm-hmm. So, and it's great to have a number, right? Because people love to see their improvement. And they love to see the improvement on the scale, and they love to see the improvement on their phone. So we talk about walking a lot. And we like to have it increase. And the phone will tell you how fast you're walking. And we want to increase that a little bit. So the phone is a great thing to monitor, or those bands. They have those exercise bands.
Right.
But you don't really need that because they're expensive. You can just use your iPhone. Has all these things on it.
So one of the things that's interesting, if you're really committed to doing this, and I've seen people that go to nutritionists do this, and it's very sobering, you write down everything you've ingested during the course of the day.
Right.
And there's a psychological effect to that in that if you have to write down what you're eating, perhaps after dinner you won't have those cookies, or you won't have that ice cream, or you won't have that cake. And it creates some accountability on the part of the patient because this is what they're going to show to either their doctor or their nutritionist to then say, when you say I can't lose weight, and you look at the list and you say, well, you're eating ice cream 5 times a week and you're having cake every lunchtime and you're drinking 3 beers a day, it's easy to see where the challenges are.
Right. So my sister is a nutritionist in California, and that's exactly what she does. She has them email or text a list of what they eat all day, and then she goes through it. And they don't want to disappoint my sister, right?
And not only that, but you're gonna get yelled at.
Right.
It's like, what are you doing eating all this food? You told me you were serious, and then all of a sudden you're eating this and this and this and this and this.
Yeah, she doesn't yell at them, but she helps them a little bit.
Encourages them not to do those things.
Yes.
So let's talk about, from a public health standpoint, what do you think needs to be done to reduce rates of obesity?
Right. So public health focuses on two things. They focus on education, and they focus on access. So education is very important. I'll give you an example. My nephew teaches home ec at an inner city school in New York City, middle school kids. Now, you'd think the middle school kids would have no interest in that, right? But what they are fascinated with him. What he does a virtual mock travel to the supermarket, and he goes over labels, and they love it.
What a great idea.
It's a great idea. And then he actually does some cooking in the schools.
Really?
Yeah, and they love it. And they learn about cooking. Instead of going to McDonald's, they do whatever kind of cooking, and he teaches them. And these are middle school kids, and they love it. So public health can really encourage these. Not every school has this. And I think it's a fantastic program for middle school kids to have a home ec, because a lot of the schools have stopped that because of financial reasons or whatever. And I was shocked. He showed me this curriculum, and he says these kids love it. And then they come home and they teach their parents.
Right. And I was going to say, I think that part of the challenge is that if you have, and I heard a statistic, it was something like if one of your parents is overweight, your chance of being overweight are like 25%. If both of your parents are overweight, then your chance of being overweight are like 70%.
Right.
So a lot of it starts in the home. So if your parents are engaged in bad eating habits, that becomes your norm. You know, you sit down, you have a large dinner, you eat way too much food, you have dessert, you have ice cream, you have, cookies later on, you eat before you go to bed. And if you develop what you think is just the normal way to engage in eating, you don't have a very good chance of losing all that weight if that's the lifestyle that you're accustomed to.
Right. And another thing is farmers markets are really important because they bring the good food. They bring the vegetables and the fruits and things like that. So public health departments are bringing farmers markets to the inner city. And that's very, very helpful. And also what they're doing is they're taking over lots, like vacant lots, and they're having communities do farming and things like that. So you're having, and that's what the public health department should be doing. They should be educating the kids on eating well and going to the supermarket and learning about labels. And then they bring in the farmers markets into the inner city. And that's huge because a lot of these low-income inner city areas, communities don't have any access to fresh food. All they see is McDonald's and all this stuff. So that's very, very helpful, and the public health departments are starting to do that.
And it's a great way to teach people about farming. It's a great way to engage in an activity that excites everyone. I remember maybe 10 years or so ago, I kind of got the bug because I would go to this Whole Foods store, and the guy in the produce department was talking about, oh my God, he grows his own fruits and vegetables. So I thought, you know what? I'm going to have a garden this year. So I tilled the soil, I put up a fence, I planted all these plants, and it was very therapeutic. Every night after work, I would come home and water the plants and pick the weeds, and it was wonderful. Until I came home one day and the deer had knocked the fence down and eaten everything in the garden. And I was like, oh my God.
Right. So
that was the end of my farming career.
Yeah, well, maybe it's not good for you, but yeah. So a lot of these vacant lots they're setting it up properly and they're learning how to do farming properly. And it's really a wonderful thing.
So final thoughts now. What are some take-home messages for our listeners that would be of great importance to somebody struggling with obesity or weight management?
Well, I think the blame game is very important. It might not be your fault. It's not all about too many donuts. And it's not hopeless. There are ways that we can help you.
Support groups, for example.
excellent because they'll teach you how to cook, and there's stuff on YouTube how to cook. So there's a lot of things out there that will help you. So yeah, it's not hopeless. See your doctor; they can help you. It's not always about surgery. There's medications now that can help you, and they can significantly decrease your risk of bad things.
And my takeaway from this is that if somebody is that miserable about their weight, and it's been so long since they've been to a gym, or they don't eat healthy, or they can't seem to lose weight, the nice thing is there are options. Yeah. There is help. There are things that can be done to get you to the point where you're living a healthier lifestyle and actually living longer.
Absolutely.
So this has been tremendous information, and I thank you very much.
You're welcome.